to meet
Yes,
somebody
and I
else's.
do think that sometimes those when we start doing things to people, like there are certain things, the way that I have always approached cancer education, because there are certain kinds,
Mhm.
like my head and neck cancer patients, I always try to take the time to remind them that the treatment for head and neck cancer, even with the best prognostic outcomes, is rough.
Yes.
And so
Yes.
there are things that we need to do to you on the front end to help you maintain your ability to continue treatment, because that's the goal.
Yes. Mm.
And I think that there's a difference in the kinds of conversations that doctors need to have when we're doing things like peg tubes, so that the
Yes.
patient understands that we're doing this not because so that you can get through the treatment, because if we're radiating, the entire radiation field is your esophagus, it's going to impede your ability to eat. So being upfront about those kinds of things versus, say, you have a locked lung because you have a malignant pleural effusion, which means that you have
Mm.
either disease in your lung or metastatic disease, and that is causing, because cancer loves water. So if you have this cancerous process going on in your lung, it's going to draw fluid into that pleural space, and so now you have a pigtail catheter that is going to help you drain that fluid off, or a peritoneal
Yeah.
catheter, same things. And I think that there are a lot of patients that end up with those kinds of devices that don't understand that those are terminal devices. So that's not something, for the
Mhm.
most part, occasionally in like gynecological tumors or things like that, where they are needing paracenteses or where they're taking fluid off their belly, then you can sometimes, that's not an end of life situation, but 99% of the time it is. And that's often a missed opportunity where doctors can really explain to the patient
Yeah.
that, this is the body process that is happening when we put this device in. And
Mhm.
I think that that's probably one of the biggest gaps that we have, is that when we start to, I call it the problem cascade, when you're going over the
Yeah.
mountain of all of the things that start to pile up on you,
Mhm.
particularly in a terminal diagnosis case, because then everything starts to kind of snowball.